This starts with your intake and screening or evaluation. So why does this matter? You can't treat what you haven't really identified yet. Too often therapists jump into treatment based on assumption or generalized labels like child is sensory seeker or has negative behavior. Instead, you want to go deeper. Today, we're diving into a key component of the treatment planning process within the Reflex Integrations Through Play framework. It's one of the essential elements that helps pediatric occupational therapists create clear, effective plans that truly support client success. Hello, I'm your host, Kokeb McDonald, and today we're starting right at the beginning, setting up your treatment plan with strong, clear, and clinically sound framework. If you want measurable, repeatable, trackable outcomes, it all starts with clarity. Think of the clinical goals as the blueprint to building a house. If the blueprint is vague or incomplete, the construction will be shaky or takes too much resource, or worse, it's unfinished. But when it's detailed and well designed, everything else falls into place. And we want to take that concept to creating our treatment plan. As occupational therapists, we deal with a variety of areas in our client's life. We deal with occupation that can lead to child's fine motor, gross motor, social skills, you name it, thing that evolves around the child's occupation or the adult occupation. For children, play is an occupation. School, education, waking up in the morning and taking care of themselves all the way to coming back to bed and putting themselves to bed. So everything is that child's occupation. The same with adults. So that can lead to occupational therapists fully overwhelmed because they don't know where to begin. And inside RITP, we talk about having a clear plan, clear protocol, and this is one of the areas that I'm going to cover today. Hopefully, as the different episode and different series that I'll have here for you, that we can break down each of the components and talk about that. So even before we start your treatment plan and start writing a goal, you need to know what the child needs. And this starts with your intake and screening or evaluation. So why does this matter? It matters because you can't treat what you haven't really identified yet. Too often therapists jump into treatment based on assumption or generalized labels like child is sensory seeker or has negative behavior. Instead, you want to go deeper. First and foremost, start by understanding the reason for referral. Why is the child being brought to you? Who made the referral? And what are their primary concerns? These questions point to the top priorities. Even if you spot other areas that need attention, start with the main concern. This can be from the parent, or this can be from the educator who recommended the child to you. Remember, you're not working in a bubble. You're not the only person working with this child. You are part of the team. When you and the referring provider or caregiver are on the same page, everything flows better. It lays the groundwork for a treatment plan that actually sticks and supports the child across all settings. And this later on will help you give out activities as a carryover or a home program or a classroom program if your goals and your focus is similar as the person who referred that child to you. So keep this one in mind because this is going to be something that will help you in the treatment planning process. Then go beyond surface behaviors. Look for root causes by becoming a behavior detective. Usually our kids are misdiagnosed or mislabeled as a behavior when in fact it can be a retained reflex pattern or it can be a sensory sensitivity that they have. So become a detective instead of labeling. Ask detailed questions. For example, when does the behavior or system occur? What preceded it? What follows the specific behavior or symptom? What does it look like in context? Like what does it look like in the classroom? What does it look like in the playground? What does it look like at home? Are there environmental, emotional, or sensory triggers? This kind of questions allows you to connect behavior or symptoms patterns to underlying sensory processing difficulty or possible routine reflex patterns the body's holding, or maybe a developmental delay. And other areas that you possibly can also work on that you might not even consider. So instead of labeling or just putting things in a box, be a detective, always trying to figure out why. Why does the brain cope this way? Why does the child prefer to cope this way in this specific situation? So always ask instead of have a blanket statement to the child that you're observing or screening, because if you have this blanket answer to every child that comes to you, you're not going to be open-minded, even catch other things. So be open-minded, don't have a blanket answer, but be curious about the child and be a detective. Another one you can do as part of your treatment planning process, use a screening tool and checklist or symptom checklist that can help you capture the different behavior, symptoms, and responses the child may have, and have a pre and post test. So that will give you a good idea of where the client is at that moment. And then you can compare it later in your treatment planning process and implementation stage. Use the RITP screening tool or symptoms checklist to document exactly what you're looking at or what you're observing. Highlight retained reflex patterns. For instance, when a child has difficulty with handwriting, slouches, frequently avoids fine motor activities, these behaviors or these responses might signal some retained primitive reflex pattern, like maybe the palmar grasp or the tonic labyrinthine or the ATNR, the asymmetrical tonic neck reflex. Try to identify these patterns early on that can allow you to target the root of this issue rather than just modifying the child's behavior by giving them an adaptive equipment. Giving adaptive equipment as a treatment plan or as part of the modification is okay, but we want to also understand the why, the reason, the root cause behind it, in addition to accommodating the child in order for them to perform. So go a little bit deeper and understand if the child is slouching. Why is the child slouching? How is the child slouching? What does the posture look like? What is the preferred seating posture? When do they slouch that way? Or how do they hold their pencil? And how do they respond? There's so many things that you can observe in the classroom or in the playground. As you go in the classroom and you are observing the child, you might see a difficulty holding the pencil, the way they're sitting, the way they position the pencil, or the way they are coping in the classroom, even how they're looking up and down and from the board, if they're squinting, whether or not they're tracking. There's so many things that goes with the child being able to even write. Start highlighting what are different reflex pattern that might be affecting the child. What are the reflex patterns that you can observe when the child is moving in the classroom? Or maybe it's in the playground. Maybe it's during PE when the child's having a difficulty participating in PE. Maybe the difficulty is not really behavior and being defiant. Maybe the child cannot really coordinate the body and keep up with the peer, and therefore the behavior is starting. So instead, you're going deeper than just the behavior that they're labeled. Instead, you're checking out the body and the coordination and the skill that they're having difficulty to perform, and whether or not there are any reflex pattern that you can easily observe. Of course, you have to be trained in doing all that, but those are the things that you can start to think about, because this is going to enable you to create a treatment plan that is measurable, trackable, repeatable, and that can give you a good framework and guideline that you can actually start to work on and give you the fastest and better result in the way that you want to work with the child. So this is part of your screening. Of course, you're always constantly going to be screening the child as you continue to work with the child, but this is something that you want to start training your clinical eye and start to identify in your sessions. Next, screen and gather a thorough history of all developmental milestones. Identify what the child has completed on time, whether they were delayed or any area of difficulty, or were there a gap between the development and the child just crawled for maybe a day or even attempted to crawl, but they didn't even crawl. They just got up and start walking. Did they roll? Did they not roll? What happened? As much as possible, get a good history. And this comprehensive view helps you understand the child's developmental path and current functional skill. We want to know, and you want to know, whether or not the child went through the developmental progression or if anything else is skipped. If something is skipped, then you're gonna know there's a little bit of gap that happened in the child's development. And later on, even though you might not see it, maybe it might affect the child later on in education and the way he processes or she processes something. Maybe it's going to be in reading, maybe in coping skill, maybe something else that you didn't even consider. Nature has everything laid out perfectly. And whenever we skip a step, it's going to affect the child. So just keep it simple in that way, that just start to figure out or get as much history as you can to see whether or not the child went through the developmental progression. Area of development that you want to track will be gross motor, fine motor, visual skill, speech and articulation, social emotional growth. So all those things that you want to start looking, even though as an OT you might be coming in for one area, you're looking at the child's overall function, and you want to look at how the child is coping in other areas as well. Are there any gaps? And these are the things that you want to start considering and jotting down in your screening. This is your intake, so you want to gather as much information about the child as possible. And of course, you're going to continue with all the evaluation that you have, that you prefer, and using in the areas that you want to target. Do that, as many evaluation as you want to do. But to help you further, especially if you are working with reflex integration work, you want to screen for any retained, unintegrated, or visible, observable reflex pattern in the child's body. This can be any of the reflex patterns that you want to look at. I recommend checking as many reflex patterns as possible. Make sure that you screen for them. These early reflex form their neurological foundation for motor and sensory development, and if retained beyond infancy, they can interfere with coordination, posture, balance, and even attention. So carefully observing movement patterns during play, transition, and task can help you identify which reflex patterns may be influencing the child's function and guide your treatment planning process. In addition, carefully observe if these reflex patterns are visible and influencing them from having efficient movement in the way they function or play or interact in their environment. Can they access the playground? Can they play with their friends? Is it age appropriate? Can they sit in the classroom and be able to function? So those are the things you can start looking for, not only in one-on-one session, but also observing them during play, transition, classroom, or playground. Also screen for functional skills by observing how the child performs these daily activities like dressing, eating, writing, playing the playground, transitioning, which can be another thing. Observe these functional skills. Can they complete these tasks smoothly and independently? Or do they rely on extra support? Are they compensating for different things? Pay attention to how much energy the child uses to complete a task. Efficiency is just as important as ability. Identifying what's hard for them helps you design an intervention that improves their functional skill, not just working on an isolated skill later on. Movement efficiency. Another one is checking for movement in motor efficiency by closely observing how the child initiates, transitions through, and completes gross or fine motor task. Is the movement smooth and coordinated, or jerky and effortful? Are they able to maintain stability and fluidity during play and transition, or do they fatigue quickly or rely on compensation? Look for signs like poor core activation, overuse of certain muscle groups, or avoidance of specific tasks. These observations can reveal underlying posture instability, motor plan issues, or routine reflex patterns that hinders efficiency and movement and give you a direction for intervention later on. As you gather all this information, don't forget to take time to understand the child mindset and coping skills. How do they typically respond to when introduced to a new activity? Do they hesitate? Do they show sign of fear or confusion, or do they dive headfirst without caution? Are they easily frustrated, or do they persist when challenged? These emotional and cognitive patterns reveal a lot about how the child processes stress, unfamiliar situation, and perceived difficulties. And recognizing these tendencies helps you plan not only what to work on, but how to approach the child's goal and the child's treatment later on. So, understanding the child's mindset is going to be really key to understanding what will work specifically for that child. Recognizing these tendencies helps you plan not only what to work on, but how to approach each goal. Whether the child needs more support or guidance, more movement-based regulation, or confidence-building approach. It really ties directly to treatment planning by shaping how you introduce tasks, grade challenge, and build tolerance and engagement over time. So, start implementing the above recommended steps during your initial screening because a strong beginning sets the tone for everything that follows. These foundation observations are what makes our treatment goals relevant and your interventions plan effective. In our next episode, we'll talk about goal setting, how to take what you've observed and the screening results that you have and translate it into a clear, functional, and motivating, targeted goal that hopefully your client will follow through. And then you can also have a goal that is measurable, trackable, and repeatable. In the meantime, if you're ready to take your treatment planning to the next level, the RITP framework is here to guide you. If you're interested in RITP program, make sure to reach out to us and join our RITP family. Go to the link below to learn more. Thank you for joining me, and I'll talk to you next time.